Good morning, everybody. Thank you for joining us for our first virtual caregiver workshop of this year. My name is Candace Christensen, and I am the coordinator for the Caregiver Coalition of Northeast Florida. We are so thrilled to have you with us this Thursday morning. So over the next 2 days, we are dedicating our time specifically to talking about living with dementia. And we have a great program lined up for both today and tomorrow. But before I jump into everything, I do have a short message from 2 of our 2021 sponsors. So I'm going to hit the play on that.
How's everybody doing?
Hey guys!
Hi! It's time to lean on each other.
All of you guys, so much great support.
And laugh with each other.
Cheers!
Let's do it together with caregiving chats and more. Come find us at aarp.org/near you.
My wife, I call her a drill sergeant. She gave me the inspiration to build myself up. I need to go on dialysis. Florida Blues, they gave my wife good information, what I ate, how she cooked, and everything. In fact, if I go to the store and buy something today, she'll get it and read it and say, you can't have this. And that's why I think I'm where I'm at today.
All right, I do want to take a moment to acknowledge and thank, on behalf of the whole Caregiver Coalition, our 2021 gold sponsors, Florida Blue and Community Hospice and Palliative Care, and our renewing silver sponsor, AARP. It's support and dedication from generous and impactful organizations that really makes a difference in what we do. So a couple more quick things before.
How's everybody doing?
This session is being recorded and it's going to be posted to our website. So all cameras and microphones, except for those of our speakers, are going to be turned off. And we ask that you just please remain muted until we reach the Q&A session if you would like to come over the microphone. If you do have any questions during the presentation, please type them into the chat box and then we'll make sure that they get answered when we reach that Q&A session towards the end. At the end of the session, we will be holding a short poll on what you liked and what you didn't like about the session, and that just helps us continue to improve them as we go on. Everyone who fills out the survey will be eligible to win a $25 Amazon gift card. We'll reach out to the winner by email after the session. And lastly, in the case that we run into any kind of technical difficulties, we're going to try and resolve them as quick as possible. It hasn't happened yet. Fingers crossed that we're not jinxing it. It's not going to happen again. So without further ado, I'm going to hand it over to Milva Ballister, Program Manager for the Alzheimer's Association Central and North Florida chapter. Milva, I'm going to stop my screen share and hand it over to you. And I'm just going to share a little bit about you while you pull your presentation up. So Milva holds her master's in public health from the University of South Florida, and she's had the opportunity to work closely with those in need, including adults with a mental health disorder and children with developmental and intellectual disabilities. Milva has a passion for health education and promotion, and it's led her to pursue her current role with the Alzheimer's Association, where she can contribute to awareness and to primary prevention efforts in the community. So the floor is all yours, Milva.
Thank you, Candace, and welcome everyone. I see a lot of familiar names and a lot of new names, but I want to thank you for taking your time and being here today. I think we have a really great program and I'm very excited to share some information with you. So welcome to the COVID-19 and Caregiving program, which is presented to you by the Alzheimer's Association. As Candace mentioned, my name is Milva. I'm a program manager here for the Alzheimer's Association in the North Florida area, and I'm based in Jacksonville. So I'm sure we have a lot of people here from Jacksonville. And today we're going to learn about COVID-19 and caregiving. And the goal is that by the end of the program, you're going to be able to understand what the relationship between COVID-19 and dementia is. We're also going to list some tips for you as caregivers and how to manage the pandemic. And then we'll summarize with some of the Alzheimer's Association resources that can help you throughout the pandemic. So as we go through the program, I'd like to encourage you just to take some notes. And as Candace mentioned, please post your questions on the chat feature. And at the end of the program, we're going to have some time to answer those questions. So let's go ahead and get started. Most likely, dementia does not increase the risk for COVID-19, which is the respiratory illness caused by the new coronavirus, just like dementia does not increase the risk for the flu. There are, however, some common characteristics of individuals that are living with dementia, such as dementia-related behaviors, increased age, and then common health conditions among older adults that may increase the risk of contracting the virus. So to give you an example here, people living with Alzheimer's disease or other dementia may forget to wash their hands or take other recommended precautions to prevent illness. In addition, diseases like COVID-19 and the flu may actually worsen cognitive impairment due to dementia. So the Alzheimer's Association has compiled helpful tips and topic sheets, which can be found at alz.org/COVID-19. And there, what you'll be able to find is tips for dementia caregivers at home. We'll go over some tips for caregivers in assisted living, tips for individuals that are receiving home-based services, and then what to expect if a nursing home has an incidence of COVID-19, and then of course, tips for staying healthy. Now, throughout the program today, we're also going to highlight some of these in more detail. The first that we're going to cover is tips for dementia caregivers at home. So caregivers of individuals that are living with Alzheimer's or other dementias should follow guidelines from the Centers for Disease Control and Prevention, which you might know as the CDC, and consider some of the following tips here. People living with dementia may need extra reminders for things like washing their hands, and this could include written and verbal reminders. It might be helpful to have sticky notes in the bathroom or by the kitchen sink. And it might be helpful for you as a caregiver to demonstrate hand washing or maybe do the activity together. Maybe sing a favorite song so you also have an opportunity to connect with your loved one. But that is going to be something to consider, that you might need to provide those extra reminders for washing your hands. Also, we want to support the individual that we are caring for while reminding them of the importance of the hygienic practices from one day to the next. So as a caregiver, it might be beneficial for you to continue providing those reminders in one short phrase. So you repeat the same information on a daily basis. We talked about the idea of placing signs or sticky notes in the bathroom or around the house to remind a loved one with Alzheimer's or dementia to wash their hands with soap for 20 seconds. And again, demonstrating thorough hand washing and doing it together might be very beneficial for you both. Now, in the event that hand washing tends to be a difficult task, you can substitute or use hand sanitizer as an alternative, as a quick alternative to hand washing. But consider that you will probably need to find an alcohol-based hand sanitizer with at least 60% alcohol. So that way you're getting the best hand sanitizer possible, and it will be a good alternative for hand washing. Now, for people living with dementia, increased confusion is often the first symptom of any illness. If a person living with dementia shows rapidly increased confusion, please contact the healthcare provider for advice. Now, there's a couple other things that you can do when you're at home with your loved one. Ask your pharmacist or doctor about filling prescriptions for a greater number of days to reduce trips to the pharmacy. For example, if you are currently getting a 30-day refill for a particular prescription, you can ask to see if you can get 90 days. So you have a 3-month supply. Also check, and I actually just found this out not too long myself, but also check if that prescription is eligible for delivery. So that will reduce the trips to the pharmacy and also reduce contact with individuals. Also think ahead and make alternative plans for the person with dementia, including adult daycare, respite, other activities that may need to be modified or canceled in response to COVID-19. Now, keep in mind that this plan may actually change a little bit more frequently than what you may intend to, and that's okay. And this is due to the ever-changing nature of the guidelines that are in place right now, right? There's a lot of places that are reopening or starting to reopen. So you want to adjust plans to make sure you account for these changes. And then also make alternative plans if you as a primary caregiver becomes sick. So you want to think about who is it that is in my care team that can help me ensure that this plan stays in place. Now, even when precautions are taken, any outside person that is entering your home does increase the risk of spreading COVID-19. The risk of exposure is greater for individuals that are living with dementia, who also tend to be older and have underlying health conditions. So to help reduce the risk associated with in-home care, it is essential that you require care providers to do several things. So you can require them to wear a face mask or a cloth face covering. Recommended personal protective equipment should be worn when personal care and medical services are being provided. Also, have them inform you if they're experiencing any fever symptoms that are consistent with COVID-19, or if they have been exposed to anyone with the virus. If so, they should not visit and they should not be there. Also, you'll have every single right to have them wash their hands with soap and water for at least 20 seconds upon arrival, and then of course, frequently throughout the day, especially after they use the bathroom, before meals, after coughing or sneezing. And then also think about the idea of avoid eating at the same time as the person with an Alzheimer's or dementia diagnosis. That can also help reduce the risk. Now, when you look at these tips that are listed on the slide, keep in mind that this is safety precautions for you and your loved ones and all individuals that are part of your care team. So perhaps asking these questions to someone entering your home may make you feel awkward or make you feel bad, but this is for your safety. So as difficult as it may be, sometimes this is absolutely, it's going to be for the safety of yourself and your loved ones. So you have every right to ask these questions. Okay, so the next thing that we'll cover is tips for caregivers of individuals in assisted living or in nursing homes. So the CDC has provided guidance to residences on infection control and prevention of COVID-19 in nursing homes. Now, of course, this guidance is set in place for the health and safety of residents and staff. And now to keep in mind here that the precautions and these guidelines may also vary based on local situations. So for more information, the CDC has information on healthcare facilities and the guidelines that they have set in place. But let's go over some of the things that you can do as a caregiver for a loved one that's in a residential care facility. So you want to check with the residents regarding their procedures for managing COVID-19 risk. So what procedures does that individual or does that facility have in place? And it's okay to also ask them what their plan is if those procedures were to change. How would they implement those changes and what that plan looks like? Now, another thing that you want to consider doing is ensuring that they have your emergency contact information and also the information of another family member or a friend that you trust with your loved one as a backup. Again, this is in the event that maybe you get sick or something happens that you're unavailable. You have a plan and then you have a backup plan. So you always want to consider those two. Of course, as difficult as it may be, please do not visit anyone in long-term care if you yourself have any signs or symptoms of illness. And depending on the situation in your local area, residences may limit or not allow visitors. And of course, this is to protect residents, but it can definitely be difficult if you're unable to see your family member. I know many of us have seen videos of caregivers getting very creative for different ways that they can still engage with their loved ones in a residential care facility. And you can certainly talk with staff at that residential care to kind of figure out the best way that you can continue engaging with loved ones. So For some people, that may be engaging in phone calls or video calls. Maybe it is through letters that you can provide to the facility to give to your loved one. Maybe it is emails, right? There's a lot of different ways that you can continue that engagement, and you can certainly get creative on how you can do so with the help of the residential care facility. And then, of course, remember that through these tips that we're providing, there's no simple answers or ways to completely eliminate the risk. Now, the next tip that we will cover is long-term care incidence consideration. So what we're going to do is we're going to break this into 3 different scenarios. So when you're maintaining the person in the residence, in the residential care facility, you want to ask the following questions. So think about, we talked about asking what their guidelines are, but also ask, what are your quarantine procedures? You know, what are you doing to ensure that everyone in here remains quarantined and is following the CDC guidelines? And of course, feel free to ask that throughout different changes that get implemented, just to make sure that you are up to date on those procedures. And then also consider asking, what is your level of confidence that CDC guidelines are being followed? So in other words, you know, the CDC has posted these guidelines. Do you feel confident that your facility is following these guidelines appropriately? And then you can ask, well, how many people in the residence have been impacted by COVID-19? Are those residents or staff, or is it both that have been impacted? And again, you can ask this various times throughout the time. So, and then of course you want to think about, is the person with dementia able to follow social distancing procedures? Are they able to do so with help or without help? So in some cases, the person may not be able to walk or move about on their own. And this could also help maintain social distancing. So think about those procedures and how your loved one is going to be able to either follow them without assistance or follow them with some assistance. And then of course, does the residents have and use personal protective equipment? What does that equipment look like? Is it facial coverings, face shields, or is it something else that they're doing to try and maintain that safety in place? Think about, well, how many staff members are interacting with your family member on a regular basis? Is there a possibility to be able to limit the number of staff who are with your family member? If you limit that number of staff, will your loved one receive the appropriate care that they need? So these questions are all things that you can ask and talk to your residential facility. And then, of course, is the residence adequately staffed to provide the level of care that your family member requires? Now, the next scenario is when you're moving a family member to another location, another care residence. So this may be an option for some. However, there's no way to know whether they will remain free of COVID-19 cases. So when you're deciding on an option like this one, the very first thing that you need to consider is, are they accepting new residents? Some nursing homes or assisted living or memory care, they may not be accepting new residents at all for whatever the reason is. If they're full or if they're not accepting anyone because of COVID-19. But whatever the reason, make sure that they are able to take new residents, and please do not start the planning process until you have that final answer. And then also, very similar to some of the questions that you would ask before, has there been any COVID-19 cases in the new residence? And again, you can ask if there has been, has it been staff or residents that have been affected? And then also you can ask some of the same questions from the previous slide regarding staffing, procedures, etc. Is staff wearing appropriate personal protective equipment? How many people are interacting with my family member? And can we limit that to limit the exposure? But are there adequate is there adequate staff to be able to provide the level of care that my loved one needs? So keep those questions in mind. And again, and I'll probably reemphasize this a couple times, there is really no simple answer or way to completely eliminate the risk. Now let's talk about moving a person back into the home. So this is our third scenario. It is very important to note that because there are no simple answers, and at this time, there's not a complete way to eliminate the risk of your family member being exposed to COVID-19, you want to consider asking yourself some questions to make sure that this is the best decision both for you and for your loved one. So here are some questions that you can consider. So you want to think about what level of care does the person need on a day-to-day basis? So for example, is your loved one able to bathe or dress themselves? Are they able to eat by themselves? Do they have other underlying health conditions that they may need to be addressed on a daily basis? Are they continent? Are they ambulatory, or do they need assistance moving? So think about that level of care and be very honest with yourself about that level of care that is needed. Once you have that figured out, think about, well, is your family able to provide the level of care that is needed? So while, of course, limiting the number of people who have contact with the individual is important, it's also important to assess the number of people that are needed to provide adequate care. Now, of course, when you're making a decision to move a person into a home, think about, well, does anyone in my family have COVID-19 currently? Or are there any individuals in the home who are working outside of the home? Because if so, then the risk for exposure is increased. And then also think about, well, is it possible to hire home care workers? And of course, this option comes with its own level of risk, which we'll go ahead and cover next. But when you're assessing these needs, and if you decide that home care workers is a necessity, keep in mind those tips that we previously discussed about asking staff to please wear their masks, to wash their hands, and asking questions about, have they been exposed to anyone with COVID-19? Have you yourself been experiencing symptoms associated with COVID-19? So please keep that in mind. Okay, so let's talk about some activities at home. Of course, for those caring for loved ones at home, it's important to develop some kind of schedule that can help you and your loved one stay engaged. And family caregivers, of course, may need to adjust your usual routines. Your routines might look different, and it might take some trial and error to get that routine down, and that's okay. The important thing is that you want to continue to engage the person that's living with dementia, whether that means that you are including them in regular tasks or planning activities that you both enjoy doing. So to do so, you want to think about creating a simple daily plan. So spend some time thinking about what the schedule for the day looks like. And this is a schedule that can help you make this adjustment easier. And the transition, if you're transitioning someone to your home, help you make that transition a little bit easier as well. And also keep in mind that at this point, you want to focus on enjoyment and not achievement. So here on the screen, you see a simple daily plan with a morning, afternoon, and evening to-do list. So of course, you want to incorporate things that are a necessity for hygienic purposes, washing and brushing your teeth, getting dressed, right? Taking a bath, getting ready for bed, washing your teeth at night. And then you want to think about what activities you're going to do for enjoyment purposes. So you can have, as they listed on here, a conversation over coffee. You can do some gardening. You can do crossword puzzles, watch some TV together. So these are all things that you want to consider when you make your plan. And again, as I mentioned, it's okay to adjust your plan. You might have to, and that's okay. You also want to make sure that when you are doing this plan, that you be mindful of any exposure to upsetting content. So if there is something on the news, a particular TV show or a movie, etc., that you're noticing triggers particular behaviors or triggers a specific upsetting response, you want to eliminate that from your plan and substitute it with an activity that is going to be more enjoyable for yourself and for your loved one. So next we'll talk about perhaps one of the more important topics here, and that is caregiver stress. So of course, throughout this time, you may experience some form of stress as a caregiver. And as a caregiver, you also need to remember that it is just as important to take care of yourself. I know that this is a topic that has been covered before, and I also know that it's easier said than done. But it's also important to know that there are resources available to you that can help you manage your levels of stress. But let's talk about some of the things that you can do to take care of yourself. And I'll start off with one that you probably have heard before, and maybe you've said, oh, I need to do it, but you haven't done so yet. And that's physical activity. It's actually been proven that physical activity is the best way to reduce stress. And also keep in mind that this is not just, going for a run or going to the gym and lifting weights. That's not just that. It's really any kind of activity that raises your heartbeat, right? And that is something that you enjoy doing. If you don't enjoy doing it, you're most likely not going to stick to it. So you can maybe go outside for a walk. If you have a dog, maybe you can take your dog around the neighborhood for a walk. Maybe you enjoy swimming and you could go out for a short swim throughout the day. Or if you are a big nature person and you enjoy watching nature, maybe you can go to a favorite trail or park, maybe ride a bike around that particular park. So there's a lot of different physical activities that you can do that can help you manage your stress. And of course, you can be very creative on those type of activities. Then let's talk about relaxation techniques. So this is also a little bit easier said than done. We've heard about maybe taking deep breaths and focusing on your breathing to help you relax. But you can also maybe take a free online yoga class. YouTube has a lot of yoga programs that are very, very beneficial. Maybe you can meditate, or if it's something that helps you relax, maybe just go get a cup of coffee or watch the local wildlife at your favorite park or even behind your house. So there's a lot of relaxation techniques, again, that you can get creative with that will help you reduce your stress levels. And then of course, get help and find support. Asking for help is very, very beneficial for caregiver stress. Remember that you have a care team that's going to help you provide care to your loved one with Alzheimer's or dementia. So it's okay to rely on that care team, especially when you need a break. So it's okay to ask for help, and it's okay to ask for help multiple times. So that is absolute key. Now, we are going to go over some resources that are available to you from the Alzheimer's Association, including our helpline and care navigation and more. But before I go into that, I want to also note the 10 symptoms of caregiver stress, which you see here on the blue side of the slide. The first one is denial. You also want to consider anger, being a little bit more easily irritated or angry. Maybe you're starting to withdraw socially. Anxiety is a very big sign to consider, a very big symptom to consider, as well as depression. Exhaustion. Exhaustion is definitely going to be evident. And if you're experiencing exhaustion to the point that you're unable to provide adequate care, it is absolutely essential to please take care of yourself at that point, so then you're able to take care of your loved ones as well. Sleeplessness, irritability, lack of concentration, and of course, health problems. And health problems here, I do want to say that a lot of the times, if you're not taking care of yourself as a caregiver, you may experience health problems before your loved one. So it's important to start slowly incorporating these stress relieving activities to ensure that you remain healthy as a caregiver and that you're able to continue providing the care that your loved one needs. So let's go ahead and dive deeper into some of the resources available to help. So the Alzheimer's Association's 24/7 helpline, you see that number here on the screen. It's 800-272-3900. This is available around the clock, 365 days a year, and they have the ability to translate in over 200 languages. So it's a very comprehensive service. It is free, and it includes specialists and master's level clinicians that offer confidential support and information to people that are living with the disease, to you as caregivers, to families, and to the public. So a couple things just to highlight what you can contact the helpline for. You can speak confidentially to these clinicians for decision-making support. Maybe you need assistance with a crisis, or maybe you need some education on issues that you face as a caregiver. You can also learn about the symptoms of Alzheimer's and other dementias. You can also learn about the local programs and services. So this includes, for example, support groups for both caregivers and those living with Alzheimer's and dementia. Or you can get general information about legal, financial, and care decisions, as well as some treatment options for managing symptoms. And then, of course, we talked about that there's over 200 languages that it's available in. So you can get help in your preferred language through all the bilingual staff or translation services. And then, of course, if assistance is needed via a teletype device, that is also available to you. Now, we have a lot of virtual programs. So as you may know, the Alzheimer's Association has transitioned all of our in-person programs to virtual platforms. So you can take programs either by webinar, similar to what we are in today, or by phone. And these programs are available to you for free, and you can find more information by visiting the Community Resource Finder, and that's communityresourcefinder.org. And let's just go over that resource. So if you visit our Community Resource Finder online, you can search for local community living services, day programs, medical resources, and more. So for example, we talked about the idea of having home health care as support for you if you're transitioning a loved one to your home. You can locate home health care services through a Community Resource Finder. And whether you are in the area, local, or across the country, you really can find services to help someone living with Alzheimer's or dementia and make all the contacts that you need to ensure safety and comfort. All right, Alz Connected is the association's very active online community for caregivers and for those individuals living with Alzheimer's or dementia. This is an online message board, and there's over 50,000 members who share their thoughts, their questions, ideas, advice with each other 24 hours a day. So you're able to browse the forums without creating a profile. And in this way, you can learn directly from other caregivers who have gone or are going through similar situations as you. And keep in mind that you do have to create a profile if you choose to post a message or a question. And the Alzheimer's Navigator. So this is very important. When you are faced with Alzheimer's disease, there's a lot of things that you want to consider. So this is really a guide to help you as caregivers answer any questions by creating a personalized action plan that can link you to information, support, and local resources. So we can help you map out a plan to approach Alzheimer's by visiting the webpage at alzheimersnavigator.org. All right, so that covers the presentation. This, I know, has a lot of information in a very short period of time. So please, at this time, if there's any questions that I can answer, I would absolutely love to do so.
Milva, I have a question just to kind of start us out. And for everyone that's on our call right now, you can type your questions into the chat. You can type, if you have any comments or thoughts, type them into the chat and we will read them out and answer any questions that we have. So Milva, what I was thinking is that, a lot of us are working from home. Some have transitioned back, but a lot of us are working from home. And for those caregivers that are working from home and also caring for someone in their home, what are some activities that, some simple activities that the loved one could do independently, say, when the caregiver is on a call or in a meeting, and there's that 45 to 60 minute block where they really just need, quiet and, an environment that they can work in. Do you have any suggestions on activities that can really engage that loved one for at least, a good 45 to 60 minutes independently?
Sure. So I think that is a very important question because I know a lot of us have transitioned into a remote environment. So our home offices are really our home offices. We're working directly from home. I think it's really important to consider really what it is that your loved one enjoys doing. Is it something like gardening? Do you have maybe seeds at home that you can help maybe plant for a little bit while you're in the meeting? Or is there something around your home office that they can actually help you with during your meeting, so you still have that kind of interaction there? You're able to do that activity together. Maybe that means organizing some papers or going through, if you have, let's say, laundry, right, that maybe needs to be done, sorting through some socks or sorting shirts versus pants versus socks. So there's definitely a lot of things that you can do at home and get creative with it. But really you want to try and involve your loved one's preferences as well.
That's really great. Thank you. Another thought I had, and you hadn't mentioned, maybe I missed it, but the virtual support groups that the Alzheimer's Association offers. So I know that they used to be in person, and then obviously we've transitioned to the virtual, and that's made them more available to a lot of caregivers who maybe are not able to leave their homes. But there is still sort of that stigma around support groups. And so I was hoping you might be able to go into, how the virtual support groups work.
Sure.
Caregivers can expect maybe on their first time, what the availabilities are like with these support groups, kind of hash it out a little for us.
Sure. So first, I just want to say that transitioning to virtual support groups has actually provided an opportunity to have many more support groups available at a time that works best for you as a caregiver. Previously, our in-person support groups were at a neutral location and they took place at a specific day and time of the month. Going virtual, we now have over 100 support groups that are available either by phone or through a virtual platform like this one, pretty much at any time that you may need. So we do have that option, the Community Resource Finder. If maybe you're having a difficult day and you want to hear from other caregivers who are maybe going through similar situations, you can go on that Community Resource Finder and look up a support group that's coming up, and you'll be able to find one within a day or two. So they're pretty, they're more frequent right now because they are virtual. Now, a couple things when you're going to a support group and maybe you haven't been there before, keep in mind that you are in an absolute safe and confidential environment. The information that you share, if you choose to share, stays within that group. And it is absolutely judgment-free. So anything that, any advice that you may be seeking or anything that you feel like you just may need to express, you can certainly do so in that support group. This is meant to be a safe place where you can share your thoughts, you can share your experiences, you can share your ideas about how to approach a situation or what difficulties you have as a caregiver, and maybe even what frustrates you. It's totally okay to share that type of information. And the thing is, if you don't feel comfortable sharing, you don't have to share. You can be there to listen and really gather that type of information from others who are going through these experiences. So, and then of course, support groups, there's certain groups that maybe might not be for you, but the beauty about having everything virtually is that you have the capacity to find other groups that might work better for you.
Thank you, Milva. The support groups are really a great resource. And like you said, you don't have to say anything. If you're not comfortable sharing, you don't have to share. But so
Right.
you said for hearing other people's stories, and maybe, you know, somebody has certain, you know, habits or little tricks that help them, you know, to care for their loved one for certain behaviors, different ways to address them. A lot can be said for hearing those things and know,
Absolutely.
okay, maybe I'll try that, you know, with mom tomorrow and see how it works, you know? So you don't have to go in, you don't have to share your feelings, even though it can be very cathartic, you know?
Absolutely. And I see a question on the chat. How do I get a loved one evaluated? So I do want to say that this is going to be between you and your primary care provider. If you are noticing changes or concerns, or maybe a difference in how one of your loved ones is engaging on a daily basis, if you're noticing maybe some warning signs, you can express that to your physician and ask to see if you can get a cognitive assessment or some kind of evaluation. And that way they're able to start providing that. Your physician may also refer you to a specialist like a neurologist or a geriatrician, but you want to start with your primary care provider. Let them know that you have concerns, what those concerns are, and that you want to get an evaluation. Also look into your insurance benefits. You may have some kind of benefit for a cognitive evaluation, and that will help you get that addressed as well.
Thanks, Milva. That's a great question. If you have any questions, like I said, you can put them in the chat. Nothing's off the table. We will do our best to answer anything. I would like to share a resource that ElderSource has. They have partnered with a program called Get Set Up, and it's a virtual engagement activity that you can do with your loved one, but they have like an online database of classes. The classes are free until the end of June, and you can access them through the ElderSource website. I actually have the website in the chat. I'm going to copy and paste it for everybody to see. But if you want to learn anything new, and like I said, you can sit down with your loved one and do these, you know, online courses, these online classes. It's a great engagement opportunity. So I'm going to copy and paste these. There's a Facebook link that you can access, and then the direct website that you can access. And these are live classes, and they have so many different topics. So a lot of options here. I'm going to share them with everybody.
And then I'll also say, as you, you know, start really getting this information like in mind, maybe you'd start developing some questions, and you can totally contact the 24/7 helpline, and they'll be able to really walk you through whatever questions or concerns you may have. So maybe no questions today, but if you're starting to implement some of these tips into your daily life, remember that that helpline is always available to you. And I'll go ahead and type that onto the chat as well.
Oh, I was just doing that.
Oh, perfect.
All right, if there are no other questions, comments, thoughts, concerns, we can go ahead and move on and wrap up.
All right. Stop sharing my screen here then.
Thanks, Nova.
Thank you very much.
Yeah, thank you. That was awesome, Milva. A lot of really great information. So while we're at the end of our time, I encourage you, like Milva said, you can reach out if you still have any questions. You can reach out to the 24/7 helpline if you have any questions for me or for the Caregiver Coalition. you can reach us at info@caregivercoalition.org. But now is the time in our workshop where we kind of get some feedback from everybody that's joining us. So if you're signing on through the Zoom app, you should be able to see a poll come up on your screen in just a moment. I'm going to go ahead and launch it right now. And this is short. It only takes a minute or two, and it really helps us to continue to improve these sessions as we plan them throughout the year. So your feedback is so appreciated. And for everybody that responds to the poll, we are doing a raffle for a $25 Amazon gift card. So this name is going to be randomly chosen after the session. We put everyone's name into a wheel of names and spin it. And then you'll be contacted through whatever email address that you use to register. So I'm going to give you a couple minutes to answer the poll, but I am going to keep talking. So I hope that you'll join us again. We have our part 2 of our Living with Dementia Caregiver Workshop Series tomorrow morning, same time, 10 a.m. And the same link that you used to access today's session should also work for tomorrow's workshop. And tomorrow we're going to hear about engaging your loved one with the use of memory aids. And we'll also hear about how palliative care could help improve the lives of those living with dementia. So kind of a different perspective. And then we're also going to have our expert panel tomorrow. Milva's going to be back and joining us on the expert panel. And we'll be answering your questions about dementia. If you find that you're not able to sign on, that's okay. You can send me your questions beforehand if there's something that you would really like to get answered, and I will read them out. So you can send them to the info@caregivercoalition.org email address. So make sure you're keeping in touch with us by subscribing to our Caring Together newsletter, and we can keep sending details and registration information for our events. And you can also like us on Facebook to see our updates right on your newsfeed. So again, if you have any other questions, comments, concerns, you can reach out to us at info@caregivercoalition.org or visit our website. It's there on the screen, caregivercoalition.org. There's a little, at the bottom of every screen, there's a questions or comments form, and you can fill those out and those get sent straight to me. So with that, I want to thank you for tuning in, sticking around with us, and I look forward to seeing everybody tomorrow morning again at 10 a.m. So thank you. Thank you for joining us, Milva.
Thank you for having me.